In this educational summary, I'll outline how to optimise the pillars of lifestyle medicine to achieve more optimal metabolic health. I'm Dr. Dave Samra, and I've spent the last decade of my career working with elite athletes to push the limits of human physiology and injury recovery. Now, I want to use the skills and knowledge I've gained as a sport and exercise physician to help patients reverse metabolic syndrome and the poor health outcomes that go with that. This summary is a guide intended for educational purposes only. It doesn't constitute the giving of medical advice, and no patient-doctor relationship is formed. Now, metabolic medicine has changed. The question is, how does a lower insulin approach work? We know now that obesity and weight gain are mediated by hormones, not just calories. Insulin is the main driver here. It helps get glucose from the bloodstream into our tissues, and it's our main energy storage hormone. Resistance to insulin happens when our body has to produce more insulin for the same effect in getting glucose into tissues. This first occurs in the muscle and liver, but the fat still remains relatively sensitive to insulin and keeps storing fat. And once we're insulin resistant, even whole grains and low GI carbohydrates stimulate a big surge of insulin that increases fat storage and perpetuates the problem of the metabolic syndrome. Now, the interesting thing here is that all the features of the metabolic syndrome, otherwise known as hyperinsulinemia syndrome, can be effectively treated with diet. And this includes obesity and all of its complications, high blood pressure, high triglycerides, the dissolved fats in blood, low HDL or the good cholesterol particles, and high sugars or pre-diabetes. Now, this basically means a smaller belt size and less medications through lifestyle. Interestingly, we see as sports physicians an improvement in pain and inflammatory markers where joint pain and soft tissue injury are unfortunately one of the earliest signs of poor metabolic health and a great opportunity to restore health, which is why many sports physicians such as myself are advocates of a low insulin lifestyle before major problems occur to people's health like a stroke or a heart attack. Now, this is Dr. David Unwin. He's a very humble GP from Norwood in England, and with his words and his outcome data, he tells the story of reviving his career and the health of his community through the use of medically monitored low carbohydrate diets. And as with many of us practicing this kind of lifestyle medicine, David and his patients have had outstanding success with the reversal of metabolic disease, insulin resistance, and even diabetes. See, when we're young and healthy, we can tolerate a lot of carbohydrates. However, with aging, time, stress, sugar intake, and the development of insulin resistance, the body can then become intolerant to carbohydrates, and they can perpetuate poor metabolic health. And many patients with type 2 diabetes can reverse their disease through the use of low-carb diets, often in combination with various forms of fasting. And while we need fat and protein to survive, there is simply no such thing as carbohydrate deficiency. Now, on average, we see that all critical measures of cholesterol actually improve on a low-carb diet. There's concern from patients and understandably doctors that cholesterol will rise when more dietary fat is eaten. And what we see is that clinical and observational trials over the last decade have shown that in most patients, a higher fat diet, especially a well-formulated one, is safe and not linked to heart disease. Now, the overall effects of low-carb diets on the body's processing of cholesterol and fat appears to be favourable in most patients, and we don't see a replacement of high sugars with high cholesterol. But if you're worried, your supervising doctor can organise specialised lipid subfraction tests and carefully assess and monitor your cholesterol individual to you. We like to see that monitoring of progress utilising a low insulin lifestyle is scientific. And just with maintaining and changing aspects of your life, we like to help you understand and learn in the long run how to become independent using the instruments that you have, just like learning to drive a car. Initially, you need to understand all of the aspects of the car and how to utilise the instruments, but eventually you're going to need to drive on your own. You need the right knowledge and the resources and a bit of practice to develop independence. One of the great things about a low-carb diet, other than it being effective, is that it has measurable biomarkers outside weight. Now, ketones are a breakdown product of fat burning, which means we can measure whether or not your body is fat adapted and is burning fat as its main fuel. If you have no ketones, you're not burning fat. And a meter can help you find your pitfalls and personalize your particular carbohydrate intake. Another great tool is a continuous glucose monitor. It's a great biofeedback tool that allows you to monitor your progress and response to different foods, exercise, stress and sleep habits. So after going over all of these potential benefits of a low carb, low insulin lifestyle, you might be wondering, why isn't this advice mainstream? Well, firstly, it goes against current dietary guidelines, which are targeted at healthy Australians. The field of nutrition is clearly filled with inherent conflicts of interest, and these seem to perpetuate some assumptions and myths where important new evidence can be ignored. We know that 2/3 of Australian adults are overweight or obese, so we're not doing very well at this. And when we look at weight loss, low-carb diets are clearly superior to low-fat diets, with 31 randomized controlled trials showing significantly better results. There is not one statistically significant, that is believable, high-quality study showing the opposite. Now, this video is not aimed at being contrarian or provocative. Neither myself or the majority of other clinicians who are advocates of low-carbohydrate diets are conspiracy theorists. But if you're not familiar with the story of the American scientist Ancel Keys, you only need to do a quick Google search to realize how fraught with scientific bias and misconduct the field of nutrition has been over the past 4 to 5 decades. Now, it's important to realize that a well-formulated low-carbohydrate diet has been shown to be safe and replete in micronutrients. Now, here is a summary of all the results of low-fat versus low-carbohydrate trials comparing important health outcomes. You can see the dark blue represents statistically significant results that favour low-carb diets, while the dark red is the statistically significant favouring low-fat diets. And it's interesting to see that almost everything favours the low-carb diets except LDL cholesterol, which does not form part of any criteria for diagnosis of the metabolic syndrome. But you might then be thinking, well, I might just play it safe and go with a CSIRO diet. They got good results, and yeah, you can see that most every diet program works for a short period of time. But the difference is sustainability. Virta are a low-carb program who've shown their results and trajectory of a well-formulated ketogenic diet is better than any other diet at the 1 year mark with 15% weight loss. But as you can see, importantly, at 2 years, the average weight loss was sustained. And that's far better than any other large-scale trial at 12% weight loss. The next concern about low-carb diets is that it involves a higher fat intake, striking up fear about fat, cholesterol, and heart disease. And this is not only a concern of patients, but unfortunately it's deeply entrenched among doctors who fear their patients will simply replace high blood sugars with high fats in the bloodstream. But recent observational evidence refutes the earlier studies to suggest that saturated fat intake is not associated with cardiovascular disease or death. The old theory of fat being deposited in arteries, called the diet heart hypothesis, has been challenged. Just because cholesterol is found in plaques that block arteries doesn't mean that dietary cholesterol is the cause. Every cell in the body makes cholesterol. It's critical for life, and far more cholesterol, in fact, is made than can be consumed or absorbed. Lipidology is a very confusing area to understand, even among physicians, and it's too often oversimplified. If you're wanting to learn more, I suggest you look up the work of Dr. Tom Dayspring and Dr. Sarah Hallberg in this area. One of the key ways to measure the atherogenicity or stickiness of cholesterol particles is to look at the particle size. Smaller, more dense particles tend to indicate that they are more atherogenic. These are the 2-year data produced from Dr. Hallberg's group at Virta Health, where they utilised low carbohydrate diets for the group on the left of the screen from baseline 1 year and 2 years going down the screen. And what you can see is a shift from the red profile toward the blue profile, which is the larger, less dense cholesterol profile, indicating reversal of the so-called metabolic dyslipidemia. So in summary, what we see in patients who are on very low carbohydrate ketogenic diets is a reduction in harmful circulating fats and triglycerides. In other words, an overall improvement in the lipid profile. It's been shown to reverse metabolic dyslipidemia. The lipoprotein particles, or the carriers of cholesterol in the bloodstream that make up this profile, are seen to improve, and we think it's because glucose damages those particles and makes it so that they can't be taken by the liver out of the circulation. In other words, they're floating around the blood for longer, and these potentially harmful particles are then exposed to the inner lining of the blood vessel wall for longer, and perhaps can then lead to more cardiovascular disease. So it does challenge the old saying, you are what you eat. And we see that, in fact, lower circulating levels of saturated fatty acids exist when people eat more saturated fat. Cholesterol is necessary but not sufficient for cardiovascular disease and stroke. And we see that patients who leave this untreated for many years get problems. But medically responsible monitoring is necessary if you're going to utilise a low carbohydrate diet and have concerns or queries about your cholesterol. The major contraindications to a low carb diet include familial hypercholesterolemia, which is a familial or genetic disorder of high cholesterol, advanced chronic kidney disease, and potentially underlying mental health concerns that might lead to high fat, high carb concurrent eating, such as severe depression or binge eating disorder. One of the other concerns about low carbohydrate diets I'd like to address is that it generally involves more red meat intake, raising concern about cancer. Now, the association between red meat intake and bowel cancer is weak and is based on observational studies of poor quality. This means that many sources of bias and factors other than red meat intake are not controlled for, especially poor recall, and these could be responsible for the slight observed absolute increase in bowel cancer risk. Now, despite their best efforts and intentions, researchers just cannot properly account for these factors in these kind of studies. And we know the lifetime risk of colorectal cancer in Australia is about 1 in 23 for men and 1 in 25 for women. But to put this in perspective, with processed meat, based on observational studies to date, the risk goes up relatively by about 15%. With red meat alone, it's 12%. But diabetes and high glucose levels are associated with high insulin, and these far outweigh the increased risk by as much as 27% in one recent meta-analysis. But importantly, it increases the mortality or death rate from that cancer by as much as 20%. So the next concern is that a low-carb diet may involve lower fibre intake, raising concern about constipation. Well, fibre is undigestible carbohydrate that stays in the gut and bulks up stool and provides nutrients to gut bacteria. Contrary to popular opinion, fibre may actually be a cause of constipation. Animal and human studies initially have shown that fibre can alter what's called transit time for food to get through and be eliminated as feces. But when fibre is studied in human subjects, lower fibre intakes have actually been shown to reduce symptoms that people complain about, the bloating, constipation, bleeding and straining. And what we know is that low carbohydrate diets can actually be higher in fibre. So as you can see, there's a few reasons that you might want to undertake a low carbohydrate, low insulin lifestyle, particularly if you have any components of the metabolic syndrome, of which at least 60% of Australians will have some components. There are very few reasons not to do a low carbohydrate diet. If you are unfortunately a patient who is suffering ill health or going down the pathway of metabolic ill health. And if you do have concerns about any of the things that I've mentioned here, sometimes the science doesn't stack up with what's being taught to people and what we're hearing from the media. So it does pay to speak to a health professional who's knowledgeable in the field. I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.